Did you know that 30 to 50% of our population suffer from insomnia daily? Personally, as a college student, I know what it is like to go through this as I am up very late doing homework and very stressed. My name is Ashley Delrosso, and today I will be talking to you about 3 of the main causes of insomnia. Now you may be wondering, what is insomnia? It is in fact, simple and short, it is the inability to fall asleep. Even if you are tired, it could fight against you. In 2009, Insomnia.net stated that insomnia is an assortment of common and physical disruptive things we face in the sleep cycle. First, I will be talking about the medical issues. Many people do not know that this could affect our sleeping pattern. In 2016, the University of Maryland said that chronic pain and antidepressants are one of the many things which are the medical issues of insomnia. Also, things such as asthma, which is difficulty breathing, allergies, which is when the immune system reacts abnormally, and our sinuses, which is when the cavities around the nasal passage become inflamed. Next, I will be talking about sleeping disorders. Sleeping disorders in 2013 from helpguide.org were said to actually be a symptom of insomnia, not two completely different things, which is what people mix up a lot of the time. Things that come from this are sleep apnea. This is when breathing stops and starts through your sleeping pattern. I personally know about this because my uncle went through this, and thankfully it was treatable with a mask you wear to sleep that helps you breathe. Simple things also can occur through sleeping disorders. You could have jet lag. If you work really late shift at work and you're extremely tired, it could wear you out to a point where you almost can't even fall asleep. How you treat your day also affects how you will fall asleep at night. And if you have caffeine within 4 to 8 hours of going to bed, you basically are setting yourself up for not falling asleep. In 2014, the sleepfoundation.org said that your brain has a sleep and a wake cycle. So when one of them is on, one of them turns off. This is basically stating that causing too much wake drive on one side or too little sleep drive on the other. Lastly is anxiety. In order to stop this, we need to manage our anxiety and control it. This coming from mental and physical distress. This can cause us to wake up, not be able to sleep. Worrying about what's coming the next day causes people to toss and to turn for hours. Also, another big point of this is clock watching. Sometimes we look at the clock and think, if I go to sleep now, I may have 4 or 5 hours left of sleep, but in reality, the more you do that, you're tricking your brain into thinking these things, and you're looking at the clock, which ends up keeping you wide awake. So the more you stress, the less sleep you get. So that is all there is for anxiety. As they say, out of men and women, women seem to face insomnia much more than men. Women facing it more due to hormonal issues, and because it says that women tend to toss and turn in their sleep much more than a man would, who may knock out right away. I then have a pie chart here to show in percentages what affects people with insomnia the most. 40% in the orange being stress, 10% in the blue being depression, we have 6% in the red being the medication, 10% being environmental factors, 5% is ill health, and 29% coming from the drinks with caffeine before sleep. In conclusion, today we learned that caffeine can keep you awake, illnesses can keep you awake, as well as your stress and your anxiety. I hope that today you took away something new, and I hope you all have a good night's sleep. Thank you. My name is Ashley Delrosso.